Now let me introduce three important species that cause yeast infections. These are Candida species, Cryptococcus neoformans, systemic mycosis. First come first, we will take Candidiasis from here and know more about it. Candidiasis is a fungal infection caused by a yeast called Candida. If we talk about its distribution, Candida species are widely distributed in the environment. They form part of the normal commensal population of the skin, gastrointestinal tract, and female genital tract. The use of broad-spectrum antibacterial agents leads to fungal overgrowth that may develop into infections. However, patients with immunodeficiencies are particularly more susceptible to this progression. Well, most infections are caused by Candida albicans. Candida albicans have other species as well, which we name as Candida tropicalis, Candida parapsilosis, Candida glabrata, and Candida pseudotropicalis. These species are responsible for infections in immunocompromised patients because they may be resistant to the antifungal agents used in therapy or prophylaxis. Moving on, let's discuss about the pathogenesis of Candida. These organisms possess melanin, that is brown pigment, adhesins, and extracellular lipases and proteinases. That is why they have a capacity to invade into the cells and cause infections. Important thing here to note that antibiotics often disturb normal bacterial flora that provide the natural resistance and protection to the body, thus leads to infections. Moving to the clinical features, what you would see in a patient of Candidiasis. Candida species cause pain and itching with creamy curd-like plaques on mucosal surfaces that bleed when removed. Skin and nail bed infections are commonly observed. In immunocompromised patients, pharyngitis and esophagitis can be severe. The associated dysphagia may lead to weight loss. Systemic invasion is common in neutropenic patients. Well, Candida species may also cause systemic and line-associated infection following broad-spectrum antimicrobial therapy in intensive care patients. If we talk about the laboratory diagnosis, it is done by microscopy, culture, or nucleic acid amplification test that we also name as NAAT. The significance of each isolate is determined in relation to the overall clinical picture. Species identification is biochemical testing or increasingly by sequencing the 18S RNA gene. Remember, Candida species are susceptible to amphotericin, with the exception of Candida lusitani. They are usually susceptible to imidazoles and to 5-flucytosine. That's all about Candida species today. Now we are moving to Cryptococcus neoformans, so stay tuned.